You're live on JoyNews desk. Welcome to the bulletin. And coming up,
loneliness, sorrow, pain, anxiety. We cannot forget when children could not attend school. We cannot forget when sermons were preached to pews. We cannot forget when what we could not see locked cities down. So we remember COVID a year on.
Yes, it's been a full 365 days already as the whole world was faced with the deadly virus. But how has Ghana fared? Be our guest as we recap the national experience and how we responded generally. And the famous plant and herb in this pandemic, the neem tree. Could it be the cure for coronavirus in Ghana?
Neem leaves can cleanse your body if you steam it. It works against coronavirus when mixed with other herbs.
More from some local herbalists as we mark the first anniversary. On Tech Thursday, we bring you the exploit of a clinical engineer at the Komfanochi Teaching Hospital who is making a difference with his ingenuity by producing some critical medical equipment for improved healthcare delivery. In business, a year after COVID-19, only 8 members of the Ghana Hotels Association have received stimulus from government. There's also going to be the latest in sports on the bulletin. Welcome. Great to have you with us. Now, while scientists across the world have been researching to find a cure for the coronavirus, local herbalists have been digging deep to find what they say could be an answer. One of the stuff that has grown in popularity during this pandemic are neem tree leaves. There's no science showing neem's efficacy against the coronavirus, but some Ghanaian herbalists have different ideas. As we mark a year after Ghana's first COVID-19 case today, Justice Beidou finds out more about Neem.
This is one of the largest markets for local herbs. Herbs come from all over West Africa for sale here. And from here, retailers buy and sell in smaller markets across the country. The people who sell here tell me that there is a cure for almost every ailment on earth, from cancer to even sexual weakness.
Mami Yale has been selling herbs here for over 20 years. She has sold a lot of herbs during this pandemic too. Some of her customers are the many people who have experienced fever, dry cough, and tiredness. All these symptoms of the COVID-19.
The virus is like asthma. The mixture I do with neem would make you vomit. And as you do, you would remove everything from your body and you will be free.
Nana Akon Enima, she too a herbalist here at the Nima market for years, claims she has used neem to help people overcome coronavirus symptoms.
Neem leaves can cleanse your body if you steam it. It works against coronavirus when mixed with other herbs. You will sweat after steaming, and that is how you get rid of the virus.
Isaac Boholu is a trained pharmacist. Even before the pandemic struck, he used to boil and inhale steam from the neem tree. Today, he does even more. Isaac makes health products from the leaf.
If you look into the scientific literature, COVID is quite new, so you may not find anything out there that proves that steaming with neem leaves will treat the COVID, okay? But on top of that, I want to say that science is always behind traditional knowledge. Because neem has a lot of compounds in them. Some of them are volatile. So if you put them in the water, the compound may come up with a vapor and then you inhale it. And who knows, it might be working for them.
Like many other plants, neem grows in abundance almost everywhere in Ghana, and yet very little has been done to add value to it. With COVID-19 and the havoc it has wreaked, maybe this is the time to see if it is the much looked for cure. Justice Bedu, JoyNews, Accra.
It's been a year on indeed, and we've been joined via Zoom for a review of Ghana's response to this pandemic in the past 1 year by the Director of Public Health at the Ghana Health Service, Dr. Frank Esiedu-Bekwai. Dr. Esiedu-Bekwai, thanks for joining us.
Thank you very much.
So, take us back to the 12th of March 2020. Just a day before that, the World Health Organization had declared that coronavirus was a global pandemic. Did you expect that we'll be seeing a case in Ghana in less than 24 hours?
Yes, thank you very much. Let me say that it was coming. I mean, Nigeria had reported their first cases, and then Cote d'Ivoire had reported. And I remember the media at that time were asking, why are we not reporting? Are we hiding? And we said, no, we were actually looking for it. We had done at that time about 50 tests, and they were all negative. So if you look at the global world now, and there's a lot of trouble, we were not surprised that we had our first cases. But clearly, the way the disease spread, it was likely going to be an imported case. And let me say that we have a good testing facility in the country at that time, which was the Buchi and then KCCR. So we were just anticipating that a case might be coming to Ghana. Our focus was that you are not likely to prevent corona from entering your country. What we're focusing on is how early to detect it. And that was our focus. So we are not surprised that we had the first cases in the country.
The cases started coming in ones and twos, and then we saw an explosion in terms of numbers in Ghana. All the same, we've still been touted as one of the countries with the effective response. What would you say was our strategy, Dr. Esiedu-Bekwai, from the very beginning in dealing with COVID?
Yeah, so let me say that before even COVID entered the country, we had really started going back. We were anticipating an outbreak of meningitis. So we have our rapid response team that was going around in northern parts of the country to see how prepared we were. And following Ebola, we had a national preparedness plan for public health emergencies. So that plan actually tried to address situations along thematic areas. So you have an area of coordination, an area of port of entry, surveillance, then you even have the general surveillance, you have the laboratory, then you have the case management, you have risk communication. So in terms of preparedness, that's what we were looking at this. So for coordination, at the national level, we have a National Technical Coordination Committee, then we have an EOC, and then if you look at the regions, they have the Emergency Management Committee. So all these structures exist. So it's not COVID that brought about these coordination structures. Then we had our lab. Luckily, we have the Buchi, which is a very reputable lab, and we had KCCR. So we have our surveillance. So we have a setup in the country that was ready to address COVID. And let me say that when we had the COVID, we actually heightened our response. So we realized that in terms of the structure itself, it more became very, very high level, very central. So we have the National Technical Coordinating Task Force, which is actually chaired by the president and co-chaired by the vice president. And that leadership is so crucial because in terms of addressing an enormous situation like COVID, you need support, financial support. And that's how we situated our response. And then we came out with clear strategic objectives. One was to limit and minimize importation. For clearly, the disease does not exist in the country. It has to come from outside. So the first objective is that limit importation. In that case, that means you need to strengthen your port of entries. So that's why in the early stages, a lot of people were talking about how prepared are we at our airport. But we said, looking at the incubation period of COVID, you are not likely to catch it at the airport. You may be having somebody incubating, you may enter the country. So you may rather get within the country rather than the airport. But we try to strengthen our airport. Then you look at second objective was how are we going to detect the cases. So that's about your surveillance system that you need to have. Then you need to have to slow down the spread, and that's how we need to do things like contact tracing, and then the risk communication, and then you have to see managing the care of the disease or the sick. So those were structures that were put in place. We really had an objective that means providing the local enterprise to support COVID. So that's why we have to now see local entities providing their own PPE. So it was a very holistic plan that we had in place.
Now, Dr. Sedubekwe, what would you say happened from August, September, October, December, where we saw that at a point we were actually doing our most tests in the country at the airport? And it was at the airports that we're doing the highest number of tests. The case count looked low, but at the same time, WACBIP did a study to see that about 1 million people in the Greater Accra region alone had tested positive for COVID antibodies. It looked then like the coordinated response that started in March had taken a nosedive.
No, you see, I think that, let me put some clarity here. Normally, when you are managing, let's say, a pandemic, what you are managing is you are managing a disease. You see, for COVID, you are looking at two things. You are looking at disease and infection. So if you look at our dashboard, now you have over 80,000. That 80,000 people, they are not all of them are sick. There are people who have been infected. So let me say, if you say you have an outbreak of meningitis, there are people who have the disease. They have been infected and they have come out with symptoms that you say, based on it, they have meningitis. For COVID, we are looking at two things. If people have been infected, they are not showing disease. They are not showing symptoms. So what a WACBIP did, they tried to find out how many Ghanaians have been exposed. You understand? So, and that one is an extrapolation. It's a sample, so it is not in view sense the number of Ghanaians that have been infected at that time. Our dashboard is clearly mainly talking about people who have been infected and also disease.
But it's still an empirical figure to go by, isn't it? Even though it's an extrapolation, I understand that totally, but it's still an empirical measure of the rate of infection. And these were people who potentially would carry and spread the disease, is it not, if they had antibodies in their system?
What I'm saying is that you cannot compare the two set of data, because one is like a survey that you're extrapolating, and one is real-time testing. So, and let me be clear, for Ghana Health Service, our intervention was not dependent on the number of cases. Our intervention has remained the same, adherence to the protocols. So it doesn't matter whether you have one case or 10,000 cases or 1 million cases. That's never the issue. And I'm sure we have never changed our stance about our interventions. So WACBIP was just demonstrating that there's a level of infection, which to us was normal. So let me say that if you look at the trajectory of the response over the period, we start very low and it got to a high level somewhere in June, July. And that rise sinks with what's happening across Africa. So if you look at the trajectory of a pandemic across Africa, what is happening like now, who's supposed to be a second wave or the first wave, sinks with most of what's happening across Africa. And then we, along the point in time, realized that people were not getting sick. You see, you cannot hide COVID. When COVID becomes very pronounced, a lot more people will become ill, a lot more people will be dying. If you look at the data from, let's say, September, October, November, we closed down our isolation centers, we closed down our treatment centers. Nobody was getting ill. It was infection. So what is happening is that at the later part of December, whereby we had this new variant. Then you have a new kind of dimension of the infection, severe disease and death. So for us, it has been a good run. Let me run you through some of the things that has happened. For, let's say, for the port of entry, before COVID, we were actually running more of a manual system. But because of COVID, we have more of electronic data collection at our point of entries. We have more booths, or to ensure that we have more space so that we ease congestion and promote physical distancing. We even have an in-house testing facility. I mean, this is one of the best things that can happen. It helps the system. It also gives convenience to the passenger. But I mean, that one, we are able to detect over 1,200 cases at the airport. So that's at the point of entry per state. If you look at the general surveillance, Ghana used to run more of a manual kind of data collection. So we tried to pilot an electronic system. When COVID came, we ran a nationwide electronic system, which is called the SORMAS. So Ghana is one of the few countries that is running a nationwide electronic data transmission. If you look at the labs, we were having just 2 labs. Now, as I speak, we have over 30 labs. A visible number of them are private. So clearly, capacity has actually improved over the period.
Right.
So there's a classes that has come because of COVID. We are not there yet, but I think that a lot has been gained over the period.
I can imagine that, Dr. Seydou. Finally, where we are now is that we are in the middle of the first phase of vaccinations. For those out there who may be concerned that the distribution of the vaccines is not as equitable as preferred, I know that there were some doctors on social media, for instance, who were expressing concern that they had not been vaccinated, and we had persons like myself, public figures and celebrities who are being vaccinated in public to sort of raise awareness. Have these issues been addressed, Dr. Seydou?
Yeah, so apparently, in trying to address the limited vaccines, we looked at the segmentation. So that's geographic, and then you look at population-wise. And then you also need to address vaccine hesitancy. So we carefully selected who to get the vaccines. So that's why we are looking at 2 main issues. Who is more likely to get a disease? Who is more likely to die? So most people to get a disease are health workers. So that's our first segmented group. Then you're looking at people who have underlying conditions, who are 60s and above, they are more likely to die. So that's also a very segmented population you need to focus on. But then you need to address vaccine hesitancy. So you need to have influencers. So that's why we now have to bring on board people like some prominent chiefs and religious leaders, and then some media personnel. But if you look at in actual terms, the numbers that have been vaccinated are still fitting the 3 key populations that we focus on: health workers, people with underlying conditions, and then the people who are 60 years and above. But let me say that with our new vaccines that we've gotten, we are moving beyond the geography to focus on the health workers. So that a week ago, our DG asked for the list of all health workers in the regions, and that's what we're going to do. So the next few days or week, we are going to make sure that all the health workers in the regions, outside the Greater Accra and Ashanti and Central, are going to be vaccinated, so that we get a very immunized workforce.
Been advisable to look at some of the other hotspots like the Western region, where we had a lot of concern come from, and try and get those health workers to quickly be vaccinated, even alongside the current number of public figures and prominent personalities who are also being vaccinated.
Yeah, so I'm saying that the health workers all over the country are going to be vaccinated. So it's not just going to the Western region. In terms of geography, Western region is going to the next, but for health workers, it's going to be across the whole country, because we are saying that health workers must be protected so that they can actually offer the kind of services that we are looking for. So, I think that a few days ago, the DG asked all regional directors to bring the list and the numbers of health workers, and that is being done. So we have a consignment of the AstraZeneca, which is purely going to health workers to ensure that we have the needed immunity among health workers.
Is this consignment already in the country? Is it part of the initial 600,000, or it's part of the next batch of vaccines?
No, not the next batch. We already have it. We have, aside the 600,000, we had some consignment from the Indian government, and then another donation from another entity. So there's a portion of the AstraZeneca and Sputnik, which is in the country, and we are going to use it. And let me say that 7,000, we even have a buffer. So we're going to use all of that to ensure that the health workers are vaccinated.
Pardon me, Doc, did I hear you say that there's a consignment of Sputnik vaccines that are already in the country?
Yes, I think we had it's about 10,000 or 15,000. If you look at Ghana now, we have actually registered 2 vaccines. So that's the AstraZeneca and the Sputnik. So far as they have been registered and they are safe for use, when we get the right kind of numbers, we'll make sure that they are put to use. But for now, we have a reasonable number of AstraZeneca which we are going to use for the health workers.
When did the Sputnik vaccines arrive, and how were they procured? Were they donations or we bought them?
They are more of I think they are more of donations that has come. You see, if you look at our strategy, we are looking at multilaterals and then bilateral entities. So like the AstraZeneca was given to us by the Indian government, and then I think the Sputnik, I think the UAE, I'm not very sure the percent, but okay. The idea is that people want to make sure that we have the right number of vaccines. So we have a limited number of the Sputnik in the country. To add to it, we have a reasonable number of the AstraZeneca to suffice the health workers.
Right. I was speaking to Dr. Nsiah-Sarri earlier today, and he was confident that the next batch of COVAX vaccines, which of course are AstraZeneca as far as we know, would arrive in the country next week. Are you able to tell us how many of the doses are coming next week?
Next week, originally this 7,000 was supposed to come in March, but it ended up coming in February. So what is happening is that the COVAX facility says that they are going to get us about 2 million doses from now to the next few weeks. It's not very certain the date, but the date tends to vary. What they are trying to say is that they are trying to cover most of the countries under the package. So when they cover it, then they go to the next phase. So I'm not certain whether it will be next week or next 2 weeks, but what is clear is that they're going to get a larger number of vaccines going forward.
Dr. Franklin Esedu-Bekwai, thank you very much for joining us this morning. And I must say that we are very grateful to and very appreciative of the great work that is being done by the Ghana Health Service and all the authorities and all the leadership. As much as we hold leadership accountable and we try and get to the bottom of issues, we really appreciate the work that you do to keep Ghanaians safe, sir. You're welcome back to Joy News Desk. Now, coronavirus affected everything, crushing economies and crippling the global health sector. Ghana's transport sector was hardly hit, with operators in the sector gradually losing their investments. Joy News' Obatampa Asa Abuaje has the following report.
As the world comes to terms with the coronavirus and its effects on socio-economic activities, businesses continue to find novel ways to stay afloat in order not to shut down. The VIP transport service is one of the many businesses whose wheels came to a screeching halt as a result of the many COVID-19 restrictions. During the lockdown, many of these buses were parked in the terminal for days. General Manager Adakabre Frimpong Manso says the imposition of restrictions caused them to find innovative ways of operating.
First, we made sure that everybody who came to our premises had to wear their nose mask, had to be given the opportunity to wash their hands and then sanitize their hands. And then we also said that without the nose mask, you wouldn't enter the buses. And then VIP also went a step further to import COVID-compliant buses where they would self-disinfect the passengers automatically, and the passenger would have had the opportunity of use of sanitizer whilst on board. VIP also sought the assistance of the Ghana Police, and we were giving some men here who would use the administrative powers given the police to more or less caution people against the misuse or failure to use the nose mask. So that has helped us tremendously to ensure that people at least know that when you get to VIP terminal, you will not get to use any of our facilities without wearing the nose mask.
In spite of the hike in fuel prices and high costs of running and maintaining fleets, the transport operators are forced to maintain the standard price. These days, people do not want to travel a lot using public transport. This has affected revenues.
We had ended up December 2019 with higher numbers averaging 10,000 passengers in and out of Accra every 24 hours, and had started the first quarter of 2020 strongly. And as we looked to consolidate the figures, then we were hit with COVID. That led to about 70% of the numbers going down. There's a steady growth of the numbers, but you can see sluggishness to the extent that there are other factors which are also kicking in, and that is making the business suffer somehow. From the beginning of the year to approaching the end of the first quarter, on average, diesel more than 5 cedis per gallon now, yet we continue to charge the same fare, and drivers also have to make do with other consumables. So it takes a toll on the operations. So that has become a challenge for management and directors of the company.
As part of efforts to minimize the spread of the virus, management has liaised with the Ghana Health Service to vaccinate the employees at the terminal. The terminal is as usual choking with commuters. Many of them are confident that the management of the VIP terminal is ensuring the safety of all stakeholders and strictly enforcing the COVID-19 protocols.
When I entered the station, I saw a lot of people, almost 95 people wearing the maxes. And I think if a person is wearing a mask and I'm wearing a mask too, it helps to prevent. That means that's if we cannot abide by the social distance and you are wearing a mask and I'm wearing a mask, it helps rather than not wearing anything at all. And I can see almost 95% wearing the mask. So I think.
Obatampa Asa Abuaji's report for JoyNews.
You're live on Joy News desk. Now, some children have been expressing frustration about having to cope with the COVID-19 restrictions for a whole year. They were dismayed when schools were shut down because of the virus, and when schools were opened, new rules kicked in. They cannot shake hands, hug, and even play actively in school like they're used to. In this report, children tell Judith Awatwe-Tando that they wish the virus would just vanish so they can get their lives back.
Sometimes I feel I want to remove it. It's itching my ears.
7-year-old Taya expressing frustration about the restrictions she's forced to follow as a result of the deadly virus. She's only a child and might not understand why she suddenly has to let go of all the things she loves to do, all in the name of the pandemic. Ideally, children are supposed to be allowed to explore their natural environment, socialize, and play. These activities might sound ordinary, but are in fact crucial to the physical and mental health of children. COVID-19 has stripped these children of such vital activities, even a hug.
It's sad because my closest friend, I can't even touch her again. And it makes me feel very unhappy because sometimes she is the only one to teach me my homework, for instance, because maybe she lives by my house and she can't even come to my house to teach me my homework. I feel very sad.
I feel strange. I don't, because of COVID-19, so you can't hug your friends.
I feel so sad because sometimes my friend can do something for me and I want to hug the person, but because of the disease, I can't even hug my friend or even give the person a peg.
Initially, kids were forced to keep indoors for months. The rationale was to keep them safe from the virus, but they found it difficult to comprehend.
When I was home, I was very boring. All I could do is just ride my bicycle, and sometimes I just go to church.
I wanted to go to beach, and when I told my father said because of this disease, no. And I also wanted to go to mall, and he said as for mall, there are many things there, no social distance will be there, so I cannot go. And I was like, I wanted this coronavirus to go.
It doesn't feel comfortable being at home all the day doing nothing, playing around doing nothing, watching TV all the day whilst nothing is interesting on it.
I feel very sad because I wanted to play and I tried to escape, and then my mother said I should not go out because I can get some of the virus and spread it to them.
It was indeed devastating for many kids as they had to spend their Christmas stuck in the confines of their homes. Although it's expected for kids to wish for gifts such as toys for Christmas, some kids said they only wished to hug their friends again.
I really wish that COVID-19 goes away, so that we stop wearing nose masks and social distancing. We can't even hug our friends anymore.
I wish everybody will be happy and coronavirus will leave this country.
A whopping 12 months have passed and children are back to school. However, they now have to struggle with the new normal. Judith Awotretando, JoyNews.
Now, Ghana relies on imports for approximately 80% of its total healthcare consumption. There are, however, avenues for the country to be self-sufficient. Senior clinical engineer at the Komfanochi Teaching Hospital, Emmanuel Rekubrobe, has set out to drive this agenda. He recently brought out a sandal crutch to aid persons with walking disabilities. He went further to produce theatre lamps, x-ray viewers, fluoroscopy machines, wheelchairs and others. On Tech Thursday, Love FM's Kwesi Deborah speaks with engineer Emmanuel Rekubrobe, who is showing the way with the local production of medical equipment.
After his secondary education at the KNUST Senior High School, his love for engineering pushed him to take up a technical course at the Kumasi Technical Institute. He went on to pursue higher national diploma in electrical and electronic engineering at the Kumasi Technical University and proceeded to the Kwame Nkrumah University of Science and Technology.
Throughout my schooling, as I said earlier on, I've been meeting people with disability, and then I've been trying hard to find out how best to come out with something to help these people. And as you can see, and as I'll soon show you when we go through the series of their operations, you will know that they are for the disability or to help people with disability. Then the second one is my son, who was born with jaundice. He had to share phototherapy device with other sick children. And you know, infection rates for that matter is very high because you don't know who brings what on board. But he was forced to be under one phototherapy device due to lack of incentives at the hospital then. And I said to myself that day that no matter what it takes, I have to do my best to come out with a solution.
As a member of the Ghana Institute of Engineers and senior clinical engineer at the Komfanochi Teaching Hospital, his love for solutions to medical problems has urged him on. Today, Emmanuel Rekubrobe has produced more than 10 medical equipment, ranging from theatre lamps, x-ray viewer, phototherapy machine, to wheelchair.
And as you can see, the phototherapy device is one of the solutions I've come out with to help the pedics section of the health sector. Then the last one is my everyday life. I work at a health institution, and each thing I see or come across, I try to come out with something.
Reporting for JoyNews, Emmanuel Kwesi Deborah.
Exciting story there. Let's continue with the program. And Dr. Anthony Siasari, Presidential Advisor on Health, was this morning on Prime Morning on Joy Prime Television. You heard me ask Dr. Isiedibeko a question related to his statements there. He was confident that next week we would have the next batch of vaccine doses in the country.
Yeah, the next set of vaccines will be coming in the next week. We are going to have a continuous delivery of vaccines. We know what we are doing in Ghana. Maybe I have to give a quick update on the vaccines. We brought in 600,000 came in through the COVAX facility.
Yes.
We have so far, as at yesterday, when I look at the data, around 10 a.m., they've vaccinated, what they've captured on the data, about half of it, about 300,000 plus. And they are still vaccinating. We will finish all the 600 for the first dose.
Okay.
The second dose will come after 8 weeks. But we have, the Food and Drug Authority has given emergency use authorization now to 2 vaccines. AstraZeneca,
yes,
and also the Sputnik from Russia.
Okay.
There are other from, I think it's a CoronaVac from China has also brought in their dossier. And I know Covaxin from India also brought in their dossier. We are looking at AstraZeneca, we are looking at Pfizer and all these things. So we have made it a point that we will bring in any vaccine which we can get available.
Okay. Do we have the number that's coming next week?
I cannot give you a number which is coming this week. But for example, the COVAX facility was supposed to send us 2.4 million. They brought in 600,000. They are supplying other countries, and I'm very sure that they will bring in the next consignment.
You're live on Joy News today, and the story continues in business when Daryl Kwao joins us with more details. Now, he will be telling us how only 8 members of the Ghana Hotels Association have received stimulus from government. And we know hoteliers have been the hardest hit in the COVID-19 pandemic. More details when we come back.
Hi there, good morning. Welcome to Business. My name is Daryl Kwao. A year after Ghana announced its first COVID-19 case and set aside a 1 billion cedi stimulus package for businesses, the Ghana Hotels Association says only 8 of its members got the money. President of the association, Dr. Edward Akanyameke Jr. says he got 3,000 cedis, an amount which could not pay for his electricity bills in a month. Odilia Ntiamwa, engaging him, lent a 9 million World Bank fund for the tourism sector, did not also get to the most needy. Here's their conversation.
We are very disappointed because, right from the beginning, when the NBSSI package was announced, we felt that the peculiar needs of the hotel industry will be lost in this whole maze of industries or businesses which the NBSSI was going to support. Because we felt that we had, quote-unquote, some special needs in terms of the quantum of our operational costs. And that became very, very obvious. So we were hoping that there would be some industry-targeted support, which the Ghana Tourism Development Project from the Ministry of Tourism, Arts and Culture tried to solve in terms of allocating
the $9 million.
$9 million, it was supposed to be allocated specifically to the tourism and hospitality industry. But guess what? Even that, which is so specific to the industry itself, has faced several challenges.
Like?
Well, when it was announced, they opened applications for it online. Members put in that application, and then they started with this disqualification criteria. Disqualified a whole lot of members based on, I think, tax, what's her name?
their tax returns?
Yeah, tax returns, and then, the tax clearance certificate, SNIT clearance certificate. A whole host of them was used to disqualify a lot of them. And then later on, some were also disqualified on the basis that even their returns does not appear like a profit-making business.
Tell me, your members that got the MBSSI money, tell me on a scale of 0 to 100, or how much were they giving? What's the highest amount you have heard from the 8 members so far?
Even the 8 members, the interesting thing is that they used the names of the directors. So I couldn't even tell which specific hotels they belong to. Okay. Now, so from those ones, I haven't even received any information. But from others who received the package, mostly it's 10%.
So what's the highest you have heard, apart from your 3,000?
The highest I've heard is 20,000.
In other news, angry traders at the Kumasi Central Market have forcibly removed barricades erected to bar them from entering the market as a deadline elapsed for them to voluntarily relocate. The traders have been asked to relocate to satellite markets to pave way for the second phase of the market redevelopment project. They, however, claim they were locked out whilst their goods remained in the market. Here's more.
The Kumasi Metropolitan Assembly served notice for the traders to vacate the central market for takeoff of the second phase of the Kejetia redevelopment project. Barricades were erected in the market to prevent trading activities at the project site. The traders, however, claim the KMA failed to make proper arrangements for their relocation. Traders who claim their goods had been locked up at the markets forcefully removed the barricade to start trading.
Why are they closing the market? Our goods are in the market. We are waiting for the police and soldiers. If you want to relocate us, we will go naked. We will relocate, but they have to look for a place for us to relocate to. Abinchi Market is not a place to send human beings to.
The KMA made arrangements at the Efiakobi market purposely for the traders' relocation. The traders, however, have concerns with the trading space.
Doctors claim the high tension at Abinchi has a lot of effect on our health.
A team of police and military personnel arrived at the market to ensure law and order. Mona Lisa Frimpong reporting.
That's business. Sports up next.
You're welcome back, and it's time for Sports on News Desk. George Addy Jr. has joined me. George, what's the latest?
Yeah, of course, Champions League and everything, but we're just keeping right in touch with what we're talking about a year after COVID, the kind of impact that we've had. And it takes me straight to the first report I filed when President Akufo-Addo announced that there was not going to be sports for the next 4 weeks because we had recorded the case weeks after we recorded the first case, and it meant that a lot of businesses connected to football were going to be affected. There's a special report from the Accra Sports Stadium where they take over kitchen services, where a lot of guys go and eat. A lot of business when there were football games. And I remember at the time, football business was booming. Accra House, when Kotoko had played at the Accra Sports Stadium, we had so many fans there.
Campaign, so many people were trooping to stadia. There were new franchises in the system.
And 5 weeks after, there was an announcement that no more sport. And our football has never been the same. We've attempted playing behind closed doors. We've tried fans going to the stadium, and we're back to behind closed doors. So this is a report that I think pretty much ends News Desk today, but helps you to reminisce where we have been, and very, very, very little in terms of improving from here.
Definitely, and we'll end News Desk on this note with this report. I'll be back at midday with Joy News today, but after News Desk comes Joy News Interactive. Here's Joy's report.
The patronagers, they buy our water, they buy our food, they buy our drinks. Now, there's a suggestion on them not to come again because of coronavirus. People who train in the sports who don't come at the same time, but they come in few numbers from time to time. Those who can come in the morning come. Those who can also train the afternoon also come, and those who train in the evening. Now there's a suggestion that all of them should stop as a result of coronavirus. It will make a situation very difficult for us.
On a regular Ghana Premier League day, Tego Kitchen Services simply is very, very busy. We've got fans coming in trying to get something to eat before the game, during the game, and sometimes after the game. I have to say business was at its peak in this season because up to 5 teams play their home games here. The likes of Inter Allies, Accra Hearts, of course, Great Olympics, Legon Cities and Kumasi Asante Kotoko. That means a lot of revenue was coming in. There was bad news for Tego Kitchen Services on Sunday.
I've come into your homes again this evening to provide an update, as I promised, on the measures taken by government to combat the coronavirus pandemic.
When the president announced that, look, all public gatherings must cease because we're trying to curb the spread of coronavirus.
Stadium business succeeds on the number of people who patronage events.
We're here to just find out how that suspension has affected business down here.
No football. Passion of the nation almost struck out by the deadly coronavirus, and the football fraternity remains shuttered. With many uncertainties, unsure about when football resumes, and even more worrying, the uncertain economic climate for businesses connected to football.
How long have you been working here? How long have you been in the stadium?
I grew up here. I've been in the stadium more than 3 decades. I started as toffee seller and then toffee and biscuit seller. I come through the stadium, through the gutter from the race course side. And by dint of hard work and God blesses, this is how far God has brought me. And when the stadium was closed for renovation for Camp 2008, I had the opportunity to follow Accra as a folk to engage in a number of friendlies with the Liberty for Professionals. And one of the encounter, I realized that there's a business opportunity because there was no water, there was no drink, and the people have to walk from the stadium outside. And at a point, I have to be sane. Whilst I was selling my toffees and biscuits, I have to be sane to go and buy water for the people. So I realized that, no, next time when they're saying game day, I'll go and sell drinks and water. And I started it and realized that all that I took there, all got finished. On more than, same thing on more than several occasions. All this while, if I bought materials 5, I increase it and continue. So after the renovation here, I cried to the authorities that I would like to occupy this shop. In fact, they advertise for people to apply to occupy the place. So I did according to the request. I went through very ethic interview I went through a very ethic interview. And after the interview, the panel members who know me, how I started, some of them knew me, how I started here. This one I will not say because they are favoring me, but they realize that I endear myself to all the questions that they pose to me. And among the people who want to occupy the place, I deserve to be there, so they give it to me.
Tego Kitchen Services is a one-stop for refreshment during games of any nature at the Accra Sports Stadium. And this season